the 2025 March of Dimes report card in National Crisis. For a little bit of background, since 2008, the March of Dimes has released this report to educate and advocate for better mom and baby outcomes across the United States, Washington, D.C., and Puerto Rico. Unfortunately, for the fourth consecutive year, the United States earned a D+ grade for preterm birth, marking the longest stretch of the lowest grade in report card history. So based on the report card, 16 states have received Ds, 8 states have received Fs, and only 1 state has received an A. But we're going to use my home state of Florida as an example. We received a grade of a D+. So positive, the severe maternal morbidity in our state has improved, but the infant mortality, the lower C-section, and the maternal mortality has worsened. And why? I can hear you asking on the other side, why? The answer, inadequate access to quality of health care before, during, and after pregnancy. And we discussed this in an episode about social determinants of health and not having access to that quality. And even in our first maternal health in the news segment, we talked about hospitals and OBs closing down. A September 2025 article, quote, infant mortality efforts in Jacksonville face local funding cut and federal policy changes, end quote. Duval County's infant mortality rate is higher than average for Florida, especially among Black babies. The Northeast Florida Healthy Start Coalition Community Health Workers Program was funded by the American Resource Plan dollars. Those dollars would have funded 2 initiatives, community health workers and syphilis screenings for infants. Unfortunately, the Jacksonville City Council removed the funding for syphilis prevention initiatives, leaving the funding for community health worker programs in the final budget. And this ties into receiving quality care. I did some research and I found an ABC article from this year that basically this type of syphilis occurs when a pregnant person with untreated syphilis passes the infection to the baby either during pregnancy or at birth. It can be treated with antibiotics. It's best to treat as soon as possible to prevent more severe complications of disease for the baby. And again, this article is from 2025. Public health experts told ABC that this type of syphilis is largely preventable, and left untreated, it can be dangerous or even deadly. 3 infants, unfortunately, in New York have died from this not being treated this year. That's not the only challenge that Duval County is facing. Effects of federal immigration enforcement and impending federal policy changes to Medicare eligibility. In the article, there's a family pediatrician named Dr. Christopher Watson. He estimates fewer than 10% of his patients have commercial insurance. So commercial insurance is like the Aetnas, the Cignas, those private insurances that people get from their employers. Nearly a third are on Medicaid, the federal health insurance program for low-income people. When President Donald Trump signed that one big beautiful bill into law on July 4th, the nonpartisan Congressional Budget Office estimates 7.8 million people would lose access to Medicaid over the next decade. Dr. Watson says the legislation, which was supported by the Northeast Florida's full congressional delegation, will have an adverse local impact. With lower reimbursement with people who have Medicaid, a lot of places will stop taking Medicaid, which will create a care deficit for women. With the laws and policies, I think we will see an increase in infant mortality.